If just standing up feels impossible right now, if your legs feel like jelly and the bed feels more like a prison than a place to rest, then this is for you. Maybe you had surgery. Maybe you were in the hospital with pneumonia or COVID. Maybe you were just tired for a long time and slowly started sitting more and more until one day you realized you cannot get out of the chair without someone pulling you up. However, you got here, I want you to hear this very clearly at the start. You are not lazy, you are not broken, and you are not done. As a surgeon who works with older adults, I have seen this exact scene so many times. A person in their 60s, 70s, 80s, even 90s, lying in a hospital or home bed, staring at their legs like they belong to someone else. They try to lift a heel, and it barely moves. They try to sit on the edge of the bed, and the world spins. Tears start to come, and they ask in a small, scared voice, "Doctor, is this it? Will I ever walk again? I wish you could stand next to me on my rounds and see what I've seen. I have seen people who could not stand at all slowly, stubbornly rebuild their strength. I have seen them go from too weak to walking down a hallway with a walker, then later with just a cane, and sometimes with nothing at all. Not because they forced themselves to walk before they were ready, not because someone yelled, just push through it. They started where their body actually was. They started in bed. Today, I'm going to guide you through what I call a 10 by 10 routine. 10 gentle, focused exercises. The goal is 10 repetitions of each. That makes 100 moments of telling your body, I still need you. Don't shut down. Will you hit 10 on every exercise today? Maybe not. Maybe some will be 3, some will be 6, some might even reach 10. That is fine. This is not a test you pass or fail. This is practice. This is rehab. This is you and me quietly waking your legs back up. You don't need to memorize anything. You can just listen to my voice and follow along as best you can. If you need to pause and rest, you pause and rest. If a movement really doesn't feel safe, you skip it for now. You are in charge of your body. Before we move, let's talk for a moment about what's happening in your legs in normal, simple language. Your legs have big muscles in your thighs and hips. Think of them as the main engines that lift you out of a chair and keep you from crashing when you walk. Those engines are expensive for your body to maintain. When you stop using them, when you are in bed for days or weeks, or mostly in a recliner, your body says, oh, we can save energy here, and it starts to shrink them. The medical word is atrophy. On top of that, the wires between your brain and your muscles, the nerve pathways, get rusty. Your brain isn't sending those strong, clear, stand up, step forward messages as often. So when you finally try to stand, everything feels shaky and uncoordinated. You might feel like your legs belong to someone else or like they'll melt and drop you. That feeling is terrifying. But here's the part I want you to grab onto. Muscles can respond at any age. Nerves can relearn at any age. The human body is incredibly stubborn in the best way. It doesn't magically happen, and it doesn't happen overnight. But when you ask these muscles to work, gently and consistently, they listen. There is another reason we are not jumping straight to walking. When your legs are this weak, forcing yourself to walk is like trying to drive a car downhill with no brakes. You may move, but you have almost no way to control or stop safely. That's how falls happen. And you know this already. One bad fall in your 70s or 80s can change everything. A broken hip, a bad head injury, a big drop in confidence. So our plan is smarter. We are going to rebuild the engine while the car is still in park, right here on your bed, where you cannot crash to the floor. Now, I have to say this because I care about your safety. If you have serious heart problems, uncontrolled blood pressure, a fresh surgery, unhealed fractures, or a history of blood clots, always clear any new exercise routine with your own doctor or physical therapist first. If during this routine you feel sharp pain, chest pain, crushing pressure, or sudden severe breathlessness, you stop immediately. A gentle muscle burn or feeling of effort is okay. Sharp, stabbing, or frightening pain is not. All right, Take a slow breath in through your nose and out through your mouth. Let your shoulders soften. Let your jaw unclench. This is your time. Let's begin with exercise number 1, ankle pumps. Lie on your back with your legs stretched out or slightly bent, whatever feels better for your back. Look down at your feet. Slowly point your toes away from you like you are trying to press a tiny button with them. Then slowly pull your toes back toward your nose. That's 1. Point away, pull back. 2. We are aiming for 10 if you can. 3. This looks so simple, but it is powerful. When the calf muscles contract, they squeeze blood up from your legs toward your heart, helping circulation and lowering the risk of clots. 4. Keep the motion smooth. 5. Don't hold your breath. 6. Inhale, exhale. 7. Feel a gentle stretch in the back of your lower legs. 8. If you can only get to 8 today, that is still a win. 9. And 10. Let your feet relax for a moment and notice the warmth or tingling. That is good. That is life moving. Exercise number 2, heel slides. Stay on your back with both legs straight to begin. Focus on your right leg first. Slowly slide your right heel along the sheet toward your bottom, bending the knee as far as is comfortable. Then slowly slide it back down until your leg is straight again. That is 1. Slide up, slide down. 2. If your heel sticks, a sock or a plastic bag under the foot can help it glide. 3. This is gently bending and straightening the knee joint and waking up the muscles in the back of your thigh and the front of your hip. 4. Keep your movement slow, not jerky. 5. This is the same bending motion your knee needs when you walk or climb stairs, but without having to hold your body weight. 6. Breathe out as you bend, in as you straighten. 7. You're doing more than you think. 8, 9, and 10. Now switch to your left leg. Slide the left heel up toward your bottom. 1, and back down. 2. Don't worry if this side feels stiffer or weaker than the other. That's very common. 3. Just go as far as is comfortable. 4. 5. Think. I'm reminding this knee how to move. 6, 7, 8, 9, and 10. Let both legs rest. Exercise number 3, thigh squeezes or quad sets. These are critical for standing safely. Keep lying on your back with both legs straight if you can. Focus on your right leg. Press the back of your knee gently down into the mattress, as if you're trying to flatten the bed under it. You'll feel the muscle on the front of your thigh tighten. Hold that for a count of 3. 1, 2, 3, and relax. That's 1. Press down again. Tighten the thigh. 1, 2, 3, and relax. 2. If you want, place your hand on your thigh and feel it firm up during the squeeze. Press and hold. 3. This is safe because the joint isn't moving, but the muscle is working hard. Press and hold. 4. It is especially helpful if you have arthritis and full motion hurts. Press and hold. 5. If your heel lifts a little, that's okay. Press and hold. 6. Keep breathing gently. 7. Try for a nice strong squeeze. 8. Almost there. 9. One more big effort. 10. Relax. Now your left leg. Press the back of your left knee into the bed. Feel that thigh muscle lock. Hold. 1, 2, 3, and relax. 1. Press and hold. 2. Every squeeze is you saying, I still need this muscle to catch me when I stand. Press and hold. 3, 4, 5. If it shakes a bit, that's just weakness being challenged. Press and hold. 6, 7, 8, 2 more, 9, and 10. Rest both legs for a breath. Exercise number 4, glute squeezes. These are for your bottom muscles, the big engines you use to stand and straighten up. Still lying on your back, I want you to squeeze your buttocks together, like you are gently pinching a coin between them. Hold that squeeze for 3 seconds. 1, 2, 3, and relax. That's 1. Squeeze again. 2. Try not to push with your feet. Let the work come from your bottom. Squeeze. 3. You might feel your hips lift just a little. That's okay. Squeeze. 4. When you stand from a chair, these are the muscles that drive you upward. Squeeze. 5. Don't hold your breath. Inhale, exhale, squeeze. 6. 7. It may feel subtle, but deep muscle fibers are waking up. Squeeze. 8. Squeeze. 9. And squeeze. 10. Let everything soften for a moment. You're doing real work. Exercise. Number 5. Pillow squeezes between the knees. Bend both knees so your feet are flat on the bed. Take a pillow or a folded towel and place it between your knees. Your feet stay a little apart. Now gently squeeze your knees toward each other, pressing into the pillow. Hold for 3 seconds. 1, 2, 3, and relax. That's 1. Squeeze again. 2. These inner thigh muscles help you keep your legs from wobbling when you stand or turn. Squeeze. 3. You may feel a slight tremble as they work. Squeeze. 4. 5. Keep the movement steady, no bouncing. Squeeze. 6. 7. Think of this as building the brakes that keep your knees from collapsing inward. Squeeze. 8. Squeeze. 9. And squeeze. 10. Gently move the pillow away and let your knees relax. Exercise. Number 6. Straight leg raises. This one is stronger. If your doctor has warned you about certain hip movements, or if your back doesn't like this, you can skip it. Bend your left knee so that foot is flat on the bed. Keep your right leg straight. First, tighten the thigh of your right leg, just like in the quad set. Then slowly lift that straight leg about 6 to 12 inches off the bed. Hold for a second. Slowly lower back down. That's 1. Tighten, lift, and lower. 2. This works your thigh and hip together. Tighten, lift, and lower. 3. If you can only lift it a few inches off the bed, that still counts. Tighten, lift, and lower. 4. This is the kind of strength you need to lift your leg into a car or over a step. Tighten, lift, and lower. 5. If your back starts to complain, make the lift smaller or rest. Tighten, lift, and lower. 6. 7. These are serious, so don't be surprised if they feel hard. 8. 2 more if you can. 9 and 10. Now switch legs. Bend your right knee, straighten your left. Tighten the left thigh first, then lift and lower. 1. Lift and lower. 2. Try to keep the knee straight. Lift and lower. 3. Smooth controlled motion. Lift and lower. 4. Lift and lower. 5. You might be breathing a bit heavier now, that's okay. Lift and lower. 6. Lift and lower. 7. Lift and lower. 8. Last 2. 9 and 10. Rest. Exercise. Number 7. Side-lying clamshells. If it is safe and not too painful, roll gently onto your right side. Bend both knees so they're stacked, one on top of the other, feet together. Keep your feet touching. Now, without rolling your hips backward, slowly lift your top knee up like opening a clamshell, then lower it back down. That's 1. Open and close. 2. This targets a small but crucial muscle on the side of your hip that helps with balance and sideways stability. Open and close. 3. Don't let your whole body twist. Keep your hips stacked. Open and close. 4. 5. You may feel a burn on the outside of your hip. That's the muscle we want. Open and close. 6, 7, 8, 9, and 10. If you can manage it, roll carefully onto your left side now. Knees bent, feet together. Lift the top knee. 1, 2, 3, nice and slow. 4, 5. This is one of the first muscles to weaken in people who fall sideways. You are strengthening your no more sideways falls system. 6, 7, 8, 9, and 10. Roll gently back onto your back. Then, when you are ready, ease yourself up into a sitting position at the edge of the bed. Take your time. If you feel dizzy, pause and breathe until it settles. Exercise. Number 8. Seated marches. Sit at the edge of the bed with your feet flat on the floor or on a small stool so they are supported. Sit up as tall as you comfortably can, holding onto the mattress or bed frame for balance. Now slowly lift your right knee up like you are marching in place, then set it back down. Then lift your left knee and set it down. That's one each side. Right up and down, left up and down. 2. This begins to train your hips and thighs for the lifting they will need when you walk. Right, left. 3. If you feel unsteady, keep at least one hand holding the bed. Right, left. 4. Try not to lean way back. A slight forward lean is fine. Right, left. 5. Feel the front of your hips working. Right, left. 6. If your feet barely leave the ground, that is okay. Little marches still wake up the muscles. Right, left. 7, right, left. 8, almost there. Right, left. 9, and right, left. 10. Exercise number 9, seated leg extensions or kicks. Stay seated, tall at the edge of the bed. Place your hands beside you or on your thighs for support. Focus on your right leg. Slowly straighten your right knee, lifting your foot so your lower leg is out in front of you. Gently squeeze the thigh, then slowly lower the foot back down. That's 1. Straighten and lower. 2. This trains the muscle that locks your knee when you stand up from a chair. Straighten and lower. 3. Keep it controlled, no swinging. 4. Straighten and lower. 5. You might see your foot tremble a bit, normal when weak muscles work. Straighten and lower. 6, 7, 8, 9, and 10. Now your left leg. Straighten, squeeze, and lower. 1. Straighten and lower. 2. If there's a bit of knee pain, make the motion smaller. 3. Straighten and lower. 4. 5. Feel the front of your thigh doing its job. 6. Straighten and lower. 7, 8, 9, and 10. Exercise number 10, seated press down, the mini push to stand. This is the bridge from bed person to standing person. Stay at the edge of the bed, feet flat, and pulled slightly back under your knees so they are not way out in front of you. Plant your feet firmly. Lean your chest forward a little, like you're trying to bring your nose over your toes. Now press your feet down into the floor as if you are about to stand up, and at the same time press your hands into the bed or onto your thighs. Feel your thigh muscles, your bottom, and your core all tighten. You may feel your hips get lighter on the bed or even lift a tiny bit. Hold that effort for 3 seconds, then fully relax back into the bed. That's 1. Lean, press, tighten everything, hold, and relax. 2. This is the exact movement pattern your body uses to stand from a chair, but we are practicing it in a safe, controlled way. Lean, press, hold, and relax. 3. Lean, press, hold, and relax. 4. If you feel safe and strong, you can let your bottom hover just a centimeter off the bed. If not, simply feeling the pressure in your legs is enough. Lean, press, hold, and relax. 5. You are teaching your brain and legs to trust each other again. Lean, press, hold, and relax. 6. Lean, press, hold, and relax. 7. 2 or 3 more if you can. Lean, press, hold, and relax. 8. Lean, press, hold, and relax. 9. Last one. Lean press. Really feel the power in your legs. Hold and relax. 10. Now pause. Take a slow breath in through your nose and out through your mouth. Notice how your legs feel compared to when we started. Warmer? Heavier in a good way? A little tired maybe, but not in that hopeless jelly way. More like they actually did something. What you just did is not small. It is not nothing. That was 100 purposeful moves. 100 times you told your body, I'm still here. I am not giving up. For most older adults, doing this 10 by 10 routine once a day is a powerful place to start. Some eventually build up to twice a day, perhaps morning and afternoon. The key is not perfection. The key is consistency. It's better to do a gentle version of this almost every day than to push too hard once, get sore or scared, and then stop for a week. You will not feel suddenly strong in a week. That is okay. What many of my patients notice first are small changes. Sitting up on the edge of the bed feels easier. Lifting the leg for the heel slide doesn't feel quite as heavy. The press down gives them a tiny moment where they feel like, oh, my legs actually caught me. Those little moments are gold. Those are your proof that your body is responding. Emotionally, this road is not easy. You might feel embarrassed that you need bed exercises. You might feel angry at your body or guilty that your family has to help you. Please hear this as if I were sitting right next to your bed, looking you in the eye. This is not failure. This is rehab. These are the same kinds of exercises physical therapists use in hospitals and rehab centers every single day with people after surgery, illness, or long bed rest. When you do them, you are not just lying there. You are training. You are doing the work. If you need a simple phrase while you move, try this. I am rebuilding. Every pump, every slide, every squeeze, every press down is a brick in the new foundation of your independence. You are building a bridge from this bed to the edge of the bed, to a chair, to the doorway, to wherever you want to go next. How will you know it might be time to go beyond bed and edge of bed work? You'll notice you can sit on the edge of the bed without feeling like you'll topple over. Your legs won't feel like complete jelly when you try the press down. Your marches get higher. Your kicks feel more controlled. When that happens, talk to your doctor or therapist about adding gentle standing and walking drills. Always safely, maybe with a walker or cane at first. Using a walker, a cane, or a helping hand is not a sign of weakness. They are tools. Just like these exercises are tools. Smart people use tools. Before we end, one more important reminder. This video is education, not personal medical advice. Your own doctor or therapist knows your full story. Your surgeries, your heart, your lungs, your bones, your medications. Always check with them before you start, change, or progress an exercise routine, especially if you have joint replacements, fractures, blood clots, serious heart or lung disease, or anything that worries you. And if at any time during or after these exercises you feel crushing chest pain, sudden shortness of breath, new severe pain, or sudden weakness, stop and get medical help. Now, as your calm, slightly stubborn surgeon on the other side of the screen, let me leave you with this. Being too weak to walk today does not mean you will never walk again. It means today is day one of rebuilding. You are not starting from zero. You are starting from a lifetime of experience, wisdom, and a decision right now to fight for your legs and your independence. If this routine gave you even a little spark of hope, please tap the like button. It helps this kind of content reach other seniors and caregivers who are frightened and searching for answers. If you want more surgeon-guided videos on strength, mobility, and recovery, subscribe to Senior Soul Care so we can keep walking this path together. And if you feel comfortable, tell me in the comments. Which of the 10 exercises felt the easiest today, and which one felt the hardest? Your words might be exactly what another person, lying in a hospital bed or at home alone, needs to read to believe that they can start too. You have already done the hardest part, choosing to try. From here on, it's one gentle, stubborn repetition at a time.